Hello, and welcome to all of you who are here with us today to watch today's informative and entertaining video, which is entirely devoted to the important and critical topic of health and wellness, specifically designed for seniors. Throughout this extensive series, we will investigate in depth and thoroughly discuss, in detail, a range of chronic health problems that affect a large percentage of seniors among our population. Whether you're a caregiver for a loved one or attempting to manage your own personal health issue, it is of the highest priority that you stay well informed about these significant matters. The initial topic that we will discuss in detail is arthritis. This is a highly prevalent condition that has a serious impact on millions of elderly individuals worldwide. Arthritis is not one medical condition, but an umbrella term that encompasses a broad range of different medical disorders. These disorders are typically characterized by signs of inflammation, chronic pain, and stiffness that can affect the joints. Indeed, medical professionals today have identified over 100 different types of arthritis, each with its own characteristics and consequences for sufferers. But out of the many forms of these various kinds, the two most commonly encountered and widespread types of arthritis are osteoarthritis, often shortened to OA for simplicity, and rheumatoid arthritis, commonly abbreviated to RA. Even though these two distinct types of arthritis attack different parts of the human body and are triggered by different underlying causes, it is important to note that both types can significantly limit an individual's freedom of movement. They can also impact negatively on the general quality of life of the victim. Let us examine more closely and thoroughly the many different symptoms that can occur in the sufferer. The most notable and easily recognizable of these symptoms are the sensations of pain experienced in the joints, which can be quite severe and uncomfortable, along with the simultaneous swelling and stiffness experienced in the affected joints, especially after long periods of immobility or rest. Additionally, for some, the level of pain and discomfort can grow even more intense and greater in reaction to fluctuations in weather conditions, or after a long, stressful day filled with vast amounts of physical exertion and activity. Osteoarthritis is recognized as a degenerative joint disease that arises when the protective cartilage, as a vital cushion between bones, gradually deteriorates and breaks down over a lengthy duration of time. The disease is most commonly observed in weight-bearing joints, such as the knees, hips, and spine, which receive the most pressure and tension during movement and everyday activities. Rheumatoid arthritis, on the other hand, is referred to as an autoimmune disease, a disorder in which the body's immune system mistakenly recognizes joint tissues of its own as foreign invaders and sets out to attack and destroy them. The ensuing inflammatory process and resulting pain become a prime source of concern for the victim. It tends to target joints such as the hands, wrists, and knees, causing very serious consequences and challenges for those who suffer from this debilitating disease. If both forms of arthritis remain untreated over time, they will necessarily result in permanent and extensive damage to the joints. It thus becomes extremely important to give top priority early diagnosis so that these possible effects may be reduced. There are several important risk factors that can potentially go a long way in increasing the risks of an individual developing arthritis in the course of their lifetime. Out of all these factors, age is one of the most crucial and significant factors, especially in the case of osteoarthritis. Osteoarthritis mainly manifests due to the normal wear and tear of the joints, which cumulatively wears them out as people advance in age and grow older. Besides, heredity also plays a vital role in the causation and exacerbation of this disease, as they help determine the natural predisposition of a person towards the development of arthritis. It must be remembered that both scientific studies and statistical data indicate that women stand a higher likelihood of contracting arthritis than men. The above fact is especially relevant when taking rheumatoid arthritis into account, which is one specific form of the mentioned disease. Along with the main causes of arthritis, there are a variety of other risk factors that can lead to the onset of this condition, such as joint injuries, obesity, and a clear lack of physical activity. To expand, obesity, or the state of having an excess amount of body weight, can put severe extra stress on the joints, particularly the knees, which are especially susceptible and affected by this rise in body weight. Also, people who have experienced a previous injury to a joint will place themselves at a far greater risk of later developing arthritis in that particular part of the body, further highlighting the effect of past injuries on joint health. Although it is a fact that, currently, there is no long-term cure that can completely eradicate arthritis, yet there are numerous effective steps and strategies that can be employed to allow individuals to successfully manage their symptoms, thereby improving their overall health. Among all the available steps, one of the most important and highly effective lines of defense against this chronic disease is the regular, continuous practice of physical exercise. Doing some gentle exercises, which can include walking, swimming, or doing yoga, can be an excellent method of ensuring that your joints remain flexible. The exercises also help in enhancing your mobility and general well-being. Physical therapy is a professional practice that offers a wide variety of benefits to patients who are interested in improving and enhancing their overall physical status. A professional practitioner in this particular practice is able to take patients through a series of specific exercises that are precisely designed to strengthen the muscles surrounding the joints. Through the process, the exercises are essential in alleviating stress on the joints while simultaneously offering enhanced support and stability to the joints throughout the range of motion. Other than possessing a regular routine of practicing various forms of exercise, weight management is one of the primary elements that contribute to attaining and sustaining general wellness. Excess weight reduction can actually play a great role in reducing the level of pressure exerted on the joints, and hence, it can bring significant alleviation of pain and discomfort normally associated with joint disorders. For most people, medications are a part of their treatment plan for arthritis. Over-the-counter pain medications like ibuprofen or acetaminophen can be taken to manage pain and inflammation, and sometimes stronger prescription medication or injections are used. The majority of elderly individuals obtain significant relief from various alternative treatments that they can avail themselves of. For instance, acupuncture, and the application of hot and cold, and the application of topical creams, can be a comforting and calming means for these individuals to achieve relief from joint pain. Furthermore, several supplements, most especially glucosamine and chondroitin, have gained an immense popularity amongst those individuals seeking to improve and optimize their joint health and status. However, it is of the utmost priority to consult with your physician prior to ever commencing any new supplement regimen, as this will serve to ensure that the supplements chosen are not only safe, but also most effective for your own personal health needs and circumstances. Engaging in stress reduction techniques and mindfulness exercises is extremely beneficial to the vast majority of individuals experiencing arthritis. The feeling of consistent pain, especially when it endures for a long duration of time, has a significant impact on one's emotional well-being. The integration of practices such as meditation or employing techniques involving slow, deep breathing exercises helps to release tension in the body and promote an increased sense of overall well-being and tranquility. Arthritis necessitates some lifestyle changes. However, it does not mean that one must completely give up one's usual activities. Elderly individuals usually find innovative methods of continuing to live an active and engaged life by using various assistive devices, including walkers, canes, or joint supports designed to provide stability and ease mobility. Furthermore, adapting the home environment, for instance, by adding grab bars and ramps, can significantly ease the process of conducting daily activities and tasks essential for independent living. It is also sensible to build up a support system. Arthritis can be isolating, yet contact with relatives, friends, or support groups may bring emotional comfort along with practical tips on how to manage. In conclusion, it matters to recognize and realize that arthritis is a common and serious issue faced by a large number of elderly individuals in our contemporary world. Nevertheless, through the use of effective treatment strategies combined with effective management approaches, it is quite feasible for those afflicted with this disease to lead an active and productive life, while suffering from the issues caused by this condition. Regardless of whether one wishes to adopt a normal routine of physical activity, adhere to a regimen of medication, or implement some alteration in one's general lifestyle, there are numerous choices that can be undertaken by an individual to actually reduce the pain of arthritis. They also lead to greater mobility, which translates into greater freedom of movement. Therefore, it is very crucial that you are well informed regarding such choices and options that are available to you. In addition, regular exercise is the key to good health and wellness. Furthermore, you must also never keep in mind that when it comes to managing the issues of arthritis, you do not necessarily have to undergo those difficulties alone. There are numerous resources available to you that you may draw upon to get the assistance and support that you need. If you learned something today, hit that subscribe button and join the crew. Who knows, maybe next time we'll tackle some other health issues that you might interested of. Stay safe and healthy for more health and wellness videos.